today? Right. So, how many of us have heard the term lifestyle medicine? Lifestyle medicine. Okay, so what comes to your mind when you hear that? Okay, okay, okay. Anybody else? Mhm. So, you all have an idea. Thank you for your response. This is Fawziyya Namtari. I'm a health psychologist and also a board certified life professional. So, my topic today is taking charge of your health using the 6 pillars of lifestyle medicine. So, firstly, what is lifestyle medicine? According to the International Board of Lifestyle Medicine, IBLM, it is a medical specialty that uses evidence based therapeutic lifestyle interventions as a way to prevent, treat, and also reverse chronic conditions. So, like diabetes, cardiovascular conditions, obesity, and related complications. Right? So, before we go into the 6 pillars of lifestyle medicine, the World Health Organization basically says that over 70% of deaths that happen globally are associated with these lifestyle conditions. Is it a surprise to us? Right. So it is something that is growing rampant, even in Nigeria now. If you see the top leading causes of death, a lot of these lifestyle conditions would also be there, especially cardiovascular disease, which, by the way, is the leading cause of death globally. That's the thing that is killing us more than anything at all, right? So, coming to why lifestyle medicine works, I want to talk about the risk factors or what are the things that actually cause these lifestyle conditions. So, one is let's talk about the behavioral risk factors. So, we have things like tobacco use, alcohol, unhealthy diet, and physical inactivity. Then we have metabolic risk factors. These are things that happen or processes that happen within our body that gives rise to these conditions. So, like high blood pressure, high blood sugar, fat in our blood, and obesity. So, these are some of the conditions that actually give rise to these chronic diseases, right? So, how lifestyle medicine works is it addresses these risk factors. If you're able to address the risk factors, you would reduce your risk of developing the disease when we talk about prevention. And then, if you already have these diseases, if you're able to implement these interventions, you're able to get better. And if you have implemented it in a very intensive way, we actually see people getting better and completely reversing that disease. So someone that has cardiovascular disease not having it anymore with these intensive lifestyle conditions. So let's come to the 6 pillars of lifestyle medicine. Number one is whole food, plant predominant eating pattern. So this is basically eating foods that are closest to how they exist in nature, unprocessed, and also, of course, eating more plants rather than focusing on animal foods. So that's the first pillar. The second pillar is physical activity. What you want to do is at least 150 minutes of exercise per week. So this can be just about 3 hours, 3 hours per week. So 1 hour 3 times a week, right? And it's better to spread it out throughout the week rather than doing the 150 minutes one day and then you're sedentary the whole week. So spreading it out. Then the third pillar is restorative sleep. The recommendation is about 7 to 9 hours for adults. So as much as possible, try to implement that. Next is stress management. We all know stress is inevitable. We all go through stress. So implementing some kind of stress management in your life, engaging in things that helps you to relax, managing your time very well so that you're not too overwhelmed. Anything that helps you relax is stress management. So that's the fourth pillar. The next is avoidance of harmful substances. So we spoke about tobacco, right, as one of the risk factors. So avoiding smoking, alcohol. Currently, the research states that there is no safe level of alcohol. So that's also another aspect. And then other psychoactive substances like cocaine and the likes. Then the last pillar is positive social connections. So ensuring that we have good quality, healthy relationships, because loneliness is one factor that also gives rise to a lot of these conditions. So making sure that you have people that you can count on, people that are there to support you, and people that you can share even positive experiences with. So these are the 6 pillars of lifestyle medicine, and I urge us to all, try and make these little changes in our life, because we have control over our health more than we think we do. So that's all I have today. Thank you for